Call this special board meeting to order.
Yeah.
We're here for a COVID update today from our Director of Health, Denise Burley. We'll turn it over to you.
Chairman Johnson, members of the board, thank you for letting me speak today. I wanted to start off by reviewing the current case numbers. And what we have in our case summary here is total cases 613 in our county, total deaths 65, with a steady increase in cases in Bullhead City. As you've probably noted lately in the last week or so, we've seen a steady increase there, and a relative stabilization in Kingman and Lake Havasu for the time being. We are continuing to monitor those surrounding counties, and I think we'll need to specifically focus attention on Clark County in the Southern Nevada Health District, in that with the opening of Laughlin and Las Vegas, we'll see an influx of visitors and people coming from outside the area to visit, and we want to ensure that we have a good pulse on the case counts over in those regions to know if there's any actions that we need to take or to partner with the Southern Nevada Health District on those. There is some funding available that's coming down the pike.
Ron Gould
has joined the conference.
There's actually two sets of funding. Of course, you're all aware of the CARES Act funding. There's also some additional funding that's coming directly to the Arizona Department of Health Services that is specific for COVID response. And we will be putting in several proposals to address some of our needs. Those proposals include increasing our interview and contact tracing capacity. And within the interview, and it's really investigative process, not interview, but it's our investigators, which has at this point been primarily our nursing staff. And it may be that we begin a recruitment at some point for some temporary positions for nursing staff, again, because they are very well suited to that type of work and follow-up. And then we would be looking at, so basically in that light, the investigative process and contact tracing is almost one person. So that nurse is doing both roles there. And then the staff that we've trained so far has been engaged in the monitoring piece. So once we've identified and isolated the positive cases, and we've done the close contact tracing, where we then look at quarantining those individuals that are close contacts of those positive cases, and then taking that a step further, where we then monitor those close contacts and positive cases. And we need somebody to do that, and that's where, when Mayor went through the contact tracing process last week, it talked a little bit about how we would monitor them, either through phone calls or through the SARA alert system for those that would sign up for that particular option in that medium. But looking at how we can scale up those resources to address some of the concerns, Supervisor Johnson, that you had about that under investigation, to speed that process up. Right now, the cases are coming in so quickly that it's very difficult for us to stay on top of those investigations. And quite honestly, our staff are getting tired. So we need to spread out and look at what we need for resources in order to meet that growing demand and growing need, and how we can move forward with that. In addition, we also recognize there are some challenges around testing. We do know that there are locations in all three communities that provide testing, and we're learning sort of in bits and pieces. We did ask all of the providers in the county whether or not they were testing or not, and we did get responses back from some. So we know the hospitals test, and they have their own criteria. We know that North Country tests for those that are their patients. And we know there are some private providers and some urgent care providers out in the community that are testing. But what we're finding is there's a greater need for some of the more So for example, a person who is symptomatic and doesn't require an admit into the hospital, it's very difficult for them to find testing. They have to call around or they have to travel some distance to get that testing, and that seems like an unrealistic barrier and something that we can work to resolve. But that would take a little while for us to do that. Of course, it would be a contracting process, an RFP process to go through in order to really secure those resources for the long term. So we're exploring that option. We're also exploring bringing some nurses on staff who could work on an on-call basis to assist us with things that basically come up throughout a week. For example, a long-term care facility contacts us, notifies us that maybe one of their patients has symptoms, and at that point, we'd really like to make sure that we test on a larger level all of their patients and possibly their staff, but that requires a great deal of resources. We have partnered in the past with Western Arizona Regional Medical Center to assist us in that process, but it still requires a lot of work on everyone's part, as those labs have to then be entered into MedSys and sent down to the state lab and then get reported. Lab slips have to be developed. So it's a lengthy process, it's time intensive, and we need to look at what resources we need for that, and that'll be a real important step for us to be taking this week to address that. I think in addition to that, we've been working with the communications director to look at how we might improve and increase our messaging out to the community, whether or not that's an emphasis on wearing masks or face coverings of some sort, which has growing merit as far as its ability to reduce the spread and the transmission of the virus. I don't think, again, I want to emphasize that it's not a fix-all by any means. We still need to continue to social distance. We still need to continue to wash our hands. We still need to continue to not come to work sick. Or if you're the employer, if you notice someone isn't feeling well, that you send them home as quickly as possible. Those are all steps that we rely on our partners out in the community to take to help us and assist us in our efforts. But, and we'll do our part on our end. I don't have any other additional updates, but I'd be happy to take any questions.
Thank you. Is there any supervisors on the phone that have any questions? Supervisor Angus?
Nothing.
Supervisor Gould?
None today, sir.
All right, I guess you guys are going to leave it up to me. You were talking about how many people that, we might possibly need to help out with the health department. How many people are we dedicating right now to the COVID response?
It might take me a little bit to get that answer to you. I'd need to go back and just be more thoughtful about my response. So I will get that number to you.
Okay.
And you're referring to in any capacity, part-time, full-time?
Right,
Okay.
right. So we got an idea how many people we have and,
Sure.
and kind of what we might need.
Sure.
You were talking about getting things out, and because it's been going on for quite a while now, people are kind of getting used to the COVID response and what we put out. Would something like, say, a person telling their, not their life story, but their COVID story, maybe a younger person, because now we have, a lot of children seem to be getting it, and then young adults, and because I know people that I've talked to have had some pretty terrible reactions to this. Would that be something we might look at, or?
I do think personal stories are helpful because there can always be a personal connection to it. And that is always something that we're looking for. And whether or not it's a media message to reach out, that people can look through the virus from a different lens. And that's always important. So yes, I do agree that would be useful.
ABC 15 out of Phoenix did an article on turnaround times for COVID tests, saying that if they are done through a lab like SonoraQuest, the turnaround time for results is getting longer and longer. Do you know if this is true, and if we're back to seeing the 7 or 8 day turnarounds?
I don't believe we have seen a 7 or 8 day turnaround time at this point. State lab will take somewhere between 24 to 48 hours to get test results back, but I don't believe we've experienced any long delays like we did at the very beginning.
Do you know how many of our cases that resulted in death had underlying health conditions?
I do not know the exact number, so I can learn that for you as well.
Are they the majority of them, do you know? Or?
I believe so, yes.
Okay. You sent us a hospitalization report. on a daily basis on the available beds. Can that be released to the public or not?
Our information that we've received, and this has been some time ago, has been that that was not information that we could release to the public, although I do believe some of that, at least in aggregate, is available on the ADHS dashboard. But I don't believe it's broken out by hospital. So I can follow up with that question as well.
All right. If there's no other questions, one thing that's been brought up is with COVID response we have and with the numbers increasing, the board needs to make a decision on continuing the monthly meetings, or to once a month. Is that something that the board would like to move today, because we have employees that need to, decide if they're going to have one meeting a month or 2 meetings a month to get stuff on the agenda? The board members that are here today, would you like to make a motion to continue that maybe until the COVID slows down?
Mr. Chairman,
Yes, sir.
I move that we continue with the board meetings once a month for the next 3 months.
We have a motion. Do we have a second? I'll second. We have a motion and a second. Further discussion? Hearing no discussion, all in favor signify by saying aye. Aye.
Aye.
Those opposed, same sign.
Aye.
Motion carries. Is there anything else to be brought up by board members? Hearing none, we are adjourned. Thank you.